All right, awesome. So we are live, so I will give it a couple of seconds to let all of our participants join. Thank you everyone for joining us this evening, and thank you to all of our alumni panelists, moderator, some of our Alliance members that are going to be here with us this evening to moderate our conversation. So I'm going to give it another minute as the participants come in. Awesome. So I'm going to turn it over to Mo. Well, first off, I wanted to introduce myself. My name is Morgan Nelson. I work in the Alumni Relations Office at Lehigh. I work closely with a lot of our alliances, and tonight we have an event that is featured by the Innovators Alliance and the Healthcare Alliance, along with the Lehigh Alumni Club of Boston. So I'm going to turn it over to Mo. Mo is going to kick it off and have at it.
Thanks, Morgan. Well, welcome everybody. I'm so glad that folks could join us this evening or whatever time it may be, wherever in the world you might be joining us from. My name is Mo Rinkunis. I'm a class of 02, 04, and 14 alum. So obviously I really love Lehigh. And if you can't tell, actually, that's a picture of Lehigh on the wall back there. So definitely had to represent tonight. But I'm really pleased to be here and representing the Lehigh Innovators Alliance. Our mission is to bring together all alumni who have an entrepreneurial mindset. We want to welcome innovators from every different undergraduate major discipline, industry that you might be in now, role that you might have. Our only requirement is that you're passionate about innovation and the impact it might have. And that's why we're so happy to have this chance to collaborate with the Healthcare Alliance and the Boston Alumni Club, because we think that we need to celebrate innovation in all of its forms. And certainly I think tonight, as we convene this panel, you certainly know that healthcare is top of mind for a lot of people with everything that's going on in the world. We've seen a rapid uptick in the adoption of new innovations, this move to telemedicine, all these great trends. And I think the really exciting thing is that there's still so much more room to innovate and have a positive impact in this space. So I'm really delighted by this panel that we've brought together. There's some Lehigh folks who are really changing the healthcare landscape. And so we hope that this panel tonight will help spark some engaging discussion around the possibilities of healthcare innovation. I do invite you, if you would like to join our Lehigh Innovators Alliance Slack group. It'll be a great place for the dialogue to continue and for you to connect with other like-minded alumni. If you're not already in our Slack channel, you can go to bit.ly/LIAJ21. And I'll put that in the chat so you can go there. But like I said, we'd love to keep the dialogue going after tonight as well. So with that, I am ready to turn it over to Kelsey Yevak, class of 2015, and our panel moderator for tonight. Kelsey is a digital health product manager at Takeda, where she applies cutting-edge AI technology to help patients manage their diseases and give providers more accurate and reliable data to improve care. She calls Boston her home and is an active member of the Lehigh Alumni Club of Boston. So take it away, Kelsey.
Thanks, Mo, for the introduction, and thanks everyone for joining today. It's such an exciting time to be in the healthcare innovation space. So I'm really happy that Lehigh brought together all of these alliances and these great panelists that we have today. So in terms of structure for this evening, we're going to start with a panel discussion amongst our panelists, and then later we'll open it up to Q&A for the audience. So at that point, you can drop some questions in your chat, and depending on how much time we have left, we can ask some questions to our panelists. So without wasting any time, I will introduce our panelists. First panelist is Jared Dashevsky. Jared is a 2019 graduate of Lehigh's Healthcare Systems Engineering program. He started his professional journey with medical school, but he quickly found a gap amongst his peers and some physicians around their knowledge of what's actually going on in healthcare. So that led him to start Healthcare Huddle, which is a news and media platform that helps to simplify the complex news and topics in healthcare today. Next up, we have Andy Lucas Schmerin. Andy earned her undergrad degree from Lehigh in 2011, and she's also a graduate of Drexel's Physician Assistant Program. She's currently a director in telehealth and customer service for a direct-to-consumer women's health platform that's called Beto. Beto ensures access to women's health products and education to women across the United States. Prior to Beto, Andy was a primary gynecological care clinician at Reproductive Associates of Delaware and also at Planned Parenthood. And then our third panelist for tonight is Russel Walters. Russel earned an undergrad degree from Lehigh in 1998 and then went on to earn a doctorate from UPenn in chemical and biomolecular engineering. He's currently the co-founder and CTO of SOM, which is a J&J digital health spinout. It's help creating personalized solutions for users to help manage their sleep health. His digital tools are currently used by over 3 million people today. So thanks everyone, especially to our panelists. I think we can go ahead and get started with the conversation. So our first question for tonight is, what sparked your passion for change in the healthcare industry, and how did you become a vital source of innovation in this facet? I will not call out any particular panelists, but please feel free to unmute yourself, guys, and anyone who wants to take the lead on this.
Yeah, I'll jump in. Thank you so much for the wonderful introduction. So I'm going to throw in a quick plug to healthcare systems engineering, because that is really where the passion was sparked, where I really started seeing healthcare from a much different angle than I previously saw it. The classes were they're very eye-opening, and it really changed the way I thought about solving problems. And so for one of my capstone projects in the healthcare systems engineering program, I put a lot of time and effort in it. It was called NARU. It was like a automated waitlist management app to basically streamline doctor appointments for patients. And I did it with one of my buddies, Jonathan Blum, who's in the technical entrepreneurship program. And it was just so fun and exhilarating to get down into the weeds, to problem solve, to brainstorm, to have those long discussions at night, talking about ideas. And so when my program finished, and I was going to start medical school at Mount Sinai, I wanted to continue this creativity, because, unfortunately, the way the education system works, it can, really damage your creative thinking. So I really wanted to make sure it was at the front of my mind. And when I got there, I really wanted to share the knowledge I learned about in the healthcare systems engineering program. Let's talk about the Affordable Care Act. Let's talk about Medicaid. Let's talk about systems reform. And when I would try to engage in conversation with a lot of my peers, I didn't really feel anything coming back. And when I asked further, it turns out they didn't know what the Affordable Care Act was. They didn't know what Medicaid was. So from that point, I started brainstorming, how can I help these people learn about healthcare? And so I interviewed everyone, really try to get down in the weeds of what is the problem? And it turns out, healthcare is very complex, right? There's 4 different parts of Medicare, which one's which. People don't have enough time because they're studying, and it's just very difficult to obtain this information. So I'm familiar with the Skim, which is a daily newsletter app, Morning Brew, which is also a daily newsletter app for business. And I was like, we're the ones for healthcare. That really speaks to students too. And so the day after my last final, I got to work and typing the first email. In January, I asked my brother, who's in this chat, Brett, who's very good at social media, to join. And he ran that game. And then my friend from medical school, Harrison, did all the tech. And so together we really built this platform, built a team after that. And so now, you know, we have over 15,000 people in our audience, and every week we're writing content and disseminating it. We're getting feedback on it. And so we really want to continue being, you know, that vital source of innovation. And yeah, so I'll end it with that. But that's where we're going. That's where I came from. And I'm very excited for the future.
That's great. I can go next. Yeah, and thank you for organizing this and inviting me to talk. My path into healthcare was circuitous. I was a chemie by training, and I still do that for sure. Out of Penn, I launched a nanotechnology company, not in healthcare so much. But sort of at my sort of base and core, I study, research, build products from complex dynamic systems and do data analytics. And healthcare is a great complex dynamic system. Humans are great complex systems. They're interesting to study. I used to do some similar research in sort of how molecules move about and organize themselves, and translating that into how humans do things is hard. Humans are much more difficult to predict than most other things. So it's a great place to think about how to impact and change systems. And I got into sleep a little bit by accident. I was working at Johnson & Johnson Consumer, and I thought it'd be fun to launch an iPhone app. This is back before this was done so much, an iPhone app to collect data from people to track some stuff and then give some recommendations. So we launched a baby sleep app more than 10 years ago now. And that took me sort of onto this path into digital health, which I find fascinating. Sleep is a great space, largely mysterious still, and ubiquitous and impactful. It's not common that you can find a space where there's still so much to learn, and it's so meaningful, and everyone does it. So I have a lot of fun working in that space, helping people understand their sleep, which is a good start. I'm really intrigued too about consumer-directed care. So engaging people to do things, to take behavior change is hard, and getting people to own what they're doing is an important piece of that. So working in sleep and helping people understand what their problems are, how they could change, how they could improve, and optimize their sleep. I think there's as far as improving yourself or improving performance, physical or cognitive, getting a 5% improvement in anything is hard, but sleep is a great place to do that. So we help people do that through digital tools, collecting some information from them, being transparent as to what we're doing with it, helping them understand, diagnose their problems, and then taking them through to sort of the first couple things to change. So it's a fun system to learn new things about, and also work with a diverse set of people. So this space demands working with clinicians, designers, coders. It's a wide breadth of fields to cover, which I enjoy quite a lot.
Yeah, so for me, kind of similar to the background of both other panelists, I was practicing in healthcare as a physician assistant, and really enjoyed educating patients about what was going on with their bodies, right? A lot of women come in and have a problem and want to know more, want to understand what's happening. And there's a huge lack of understanding about the female body just in normal everyday life. More often than not, we're not taught about how our bodies are supposed to work and what's normal, what's not normal. Probably very similar to a lot of the sleep work that you're doing. It's something that most people engage with at some point in their life and chalk things up to, oh, that's just the way I am. And so things become normalized over a period of time. So the kind of problem is in our healthcare systems, we're not incentivized to really sit down and talk with each other and have real conversation and get to these root causes and these root problems of what may be at the base of what's happening. And so frequently women just wanted to come in and talk. They didn't need to come in and have me do an exam. They didn't need to necessarily come in and have me write a prescription for something. They just wanted to talk and better understand what was happening. So that's kind of where I really saw the most opportunity to, offer something to women that they were really asking for. And I kind of stumbled into Beto through a very good friend of mine from high school who had started this company while I was simultaneously working. I ironically was an early adopter, a customer, and eventually was like, hey, are you looking for providers? I'd love to work and help you with your mission, because I feel very strongly about the work that you're doing, and I'd love to help drive that work forward. So I found myself at Beto and helping to really reach women and educate women in all things women's health, from the first start of a period to and through menopause.
Awesome. Thanks, everyone. I kind of want to go back to something Russell mentioned about the complex cast of characters we need to work with while working in the healthcare industry. So often to get digital technology and healthcare off the ground, you have to work with people like clinicians and other healthcare practitioners. So how do you really inspire innovation in groups like that, where everyone has different backgrounds, and as innovators, we're really the ones forging into the space that, and forcing change?
I can go first this time. Yeah, that's a great question. Well framed. It's certainly hard. I think it's quite important to start out humbly observing and listening. Lots of people have lots of great background and experience. I've worked with clinicians in lots of different ways. There's certainly much to learn from them. Their domain expertise is fantastic. There's much to learn, but at the same time, they're very good at operating the way they operate, which is typically in clinic one-on-one. You typically don't want to replicate that. You can't do that same thing remote. You can do different things remotely and digitally. You can gain information in different ways. It's important to understand what they're doing, but it needs to be transformed. So listening is great, but then you need to sort of take some ownership and move away from what feels comfortable to them, to create a new thing that may feel a little uncomfortable to them. And yeah, I think that process, I think, is fascinating and hard. And it needs to happen. It needs to happen a lot more than it is so far. So, doing a remote visit, seeing a doctor like this over Zoom is fine, but then really transforming healthcare into a digital system process takes a few more steps than that. And there's a lot more to offer if you can figure out some of those steps.
I would say too, there's some unique aspects of healthcare that lend itself to innovation. We're very multidisciplinary, right? So people who are in healthcare are used to working across teams. So there is, I would, generally speaking, a level of understanding of working across realms. That being said, though, normally it's within the system that they know. So that's kind of where the push and pull comes. So it's, more of finding those right people that are willing and see that right opportunity, because when you do find those providers or professionals who have that same vision and can see where you want to go and where you're trying to take things, they can really help. It just takes a couple. And then once the data starts flowing, usually anybody in science is pretty willing to look at data and say, yeah, this makes sense. If you're doing it the right way and collecting it the right way. So I would say that that's like really the biggest thing, finding those first couple people to really like hop on board. And that's in any innovation industry, right? Like that's not just healthcare, that's anytime you're trying anything new.
Yeah, so I guess for Healthcare Huddle, so it's not a healthcare company, it's a media company. So what we started at first to really solidify is like the mission and the vision. Because if you have an attractive mission and vision, people will gravitate towards your company. And so that's actually what happened. A lot of people who joined the team just really direct message us on Instagram. cold emailed me, and we had conversations and we onboarded, and to this day we continue to get more and more emails, direct messages saying, hey, can I join? And it's really gratifying. And I think what we did correctly was really focus on being transparent, being open to feedback, and then improving on that feedback. And if you ask anyone on our team, like what my favorite word is, it's iterate. Like you iterate. And this can't happen if you're not open to feedback, if you're not willing to take responsibility for your actions, if you're not willing to have those long brainstorming sessions to figure out, like, what is the best way for us to make money? What's the next newsletter we should do? Stuff like that. And to this day, like I still rely on those principles. It's part of our core team values. It's transparency, continuous improvement, community, and curiosity. And we hammer this home. And a fun fact about our team is it's all virtual. Besides my brother, besides my friend from medical school, and my friend Julia, who was a Lehigh alumni and now a PA student at Cornell, I haven't met anyone else on the team, and we're a team of 14, 15. So it's been very important to stay true to these values, because as soon as you slack off, you can't just high five a person in the hallway, right? Like there needs to be a constant form of communication. The team needs to know that if something goes wrong, they need to speak up, and they know that I'm all ears. So that's really what we've been doing, and it's turned out to work pretty well. Obviously problems arise, but this iterative mindset really helps you stay on your toes and think quickly. Shout out again to the Healthcare Systems Engineering program for teaching me that word, iterate.
Yeah, I completely agree, and I can't support that enough. And I think it's one of the opportunities for digital health, and I think one of the challenges that pharma companies often have that is not the model. The model is design, research, study, take a lot of time because you have to before you can launch it, and then launch it once a long time later. Getting that sort of rapid iteration is critical, and you can't. It's hard to innovate without it.
I love the concept of iteration, and I'm sure with these alliances on the phone, a lot of people are familiar with the lean startup model and really failing fast and learning from it so that you can improve your product. So along those same lines, how do you all view failure and adaptive leadership in relation to innovation in your different organizations?
I can go. Failure, I feel like this is like the inevitable question on all of these kinds of conversations. Failure is inevitable. You're going to fail in all aspects in some way in your life. And it has like such a negative connotation. For me, what I always try to figure out is, like, what kind of bucket does this failure fall into? Is it a failure that we just have to put on the back burner till we get some more groundwork covered so that then that failure can turn into a success? Is it, the goal that we're trying to accomplish is still good, but we just need to get there in a different way. So we need to figure out a different path forward to make that a success. Or is it that end goal that's a problem, right? So like really trying to, look at it carefully to figure out at what part was the breakdown, so that you can really grow from it and better understand what was happening. Every failure is going to teach you something. It may be like, yeah, that end goal, right? A lot of people think of it as like, oh, that was just a bad idea. And sometimes it's just not the right idea. But more often than not, it's one of those other first two buckets. Like you just need to lay some more groundwork in order for it to be successful, or you just need to go about it a different way for people to grab onto it. And that's, I think, where a lot of times people lose an opportunity to turn a failure into something that's really quite successful.
Yeah, I think the sort of what comes next is interesting, right? Everything is adapted from someplace else. The failure success, I find overly binary, and maybe I like ambiguity a whole bunch. Very few things are complete successes. Everything goes wrong lots of different ways. Things that look good and turn out well went wrong lots of different ways. I mean, I've done many things that well, there's hardly a thing I've done that went the way I thought it would go. And then they're not usually failures. They're things that we've sort of moved forward from in different ways. And to the iterate point again, the first and most important thing to do is take some action and learn and change. So, trying to avoid failure it just means you do nothing. So taking action and taking some steps forward and adapting is the only way to get anything done.
Yeah, so I agree with both those statements. Failure is inevitable and is also very uncomfortable, especially at first. And I saw a quote the other day that, being a leader, you're in a constant state of discomfort because you never know what's going to happen. Like you're always trying to figure out what's going to come next. But I think once you get comfortable with that feeling of being uncomfortable, you're more open to failure. And whenever we have a quote unquote failure or a mistake in part of our operations, we always do like some root cause analysis where we really like dig deep to figure out where did we go wrong. Someone wrote in the chat, it's usually because of a misstep. And when we do look at what went wrong, it is because of a misstep, and it forces us to reevaluate the processes we have and make new ones. And to give an example, in June, we sent out a newsletter that had a typographical error and said there's basically, I think, 200 billion cases of COVID-19. An obvious typographical error, but it has an impact and it could damage your trustworthiness as a media company. So we dug deep, we tried to figure out what went wrong, and it turned out that we had too many people editing one article on the same day, too many cooks in the kitchen. So what we decided to do, going back to the word iterate, is create a more iterative process where the newsletter, the content is done on Wednesday, gets edited by the first person revises it, Thursday, new person edits, Friday, new person edits, and then it's good to go by Saturday. So, accept failure with open arms, and it's not enough to just say, we failed, let's move on. You need to figure out what went wrong, because, iterate, you just get better and better.
I really like where you're going with the example, Jared. And this is something I was thinking about, when reading both Jared and Andy, your current work. In a world of kind of like untrusted news sources, it's interesting that you're both providing content to patients and to providers. So how do you really capture your readers' trust in your content?
Yeah, for us, trust is huge. And there's times when sometimes that trust breaks down, and typographical errors, typos are a huge part of that. And they happen to the best of us. It's happened on our end as well. And it can be really frustrating. I think for us, the biggest way that we build trust is being ourselves, being really genuine. So, when we're on our platforms, whether it's information content on our site, on our social platforms, you're seeing me, you're seeing Nurse Susie, our founder. So people know who we are. They're seeing us on a day-to-day basis. They're seeing me like this. They're also seeing me like after I've been with my kids half the day and my hair looks a mess, So there's this relatability standpoint. A lot of our customers also can have a chat with us on our website. So when they're chatting in, often they're getting me, so there's a lot of touch points where they're realizing, oh, this is these actual people who truly are looking at things. They're not these like robots that are at the other side of a computer, which I think sometimes it is a robot, but in our case, it's not, right? We're dealing with health information. Often we're trying to give guidance for people in the health of their life. So we take really great pride in taking personal touch on every single account that signs up with us. So for us, that makes a huge difference in being able to just build that trust with our customers.
Yes, I'll add, majority of our audience is between like 18 and 34, a lot of students, a lot of young professionals. And one thing we really try to do is speak in a very conversational tone wherever we're writing. So when you read the newsletter, it's not a doctor with all this experience in healthcare who's writing like a manuscript. It's someone it's like your friend you're reading your friend's article, and it's supposed to sound very casual, and to really build this like humanizing relationship with the healthcare huddle. Like, these are people. Yes, they make mistakes. And a couple of weeks ago, we had another error on one of our Instagram posts, and instead of taking it down, which was a knee-jerk reaction, it was like, we got to remove it. We said, well, wait. What if we just comment and say, listen, on slide XYZ, there's an error. Errors happen. We're sorry. We're human. And that way, like, you see the human touch to it. Like, there are humans behind this content. It's not a robot making it. So one of the key things we want to continue to emphasize is humanizing our content. And what we're doing right now is having like a vaccination campaign where if someone in our audience gets vaccinated, we tell them to send us a picture of them, and we post on our Instagram to show like we're building a community. This isn't just 5 people writing a newsletter. It's a whole community of people who are reading it, engaging in conversation, and hopefully getting motivated to change healthcare like all of us.
Yeah, it's amazing how important being human is. Oftentimes I do build robots in the back end to understand things and make decisions, but having a human front and human understanding, and putting myself out as well and being human is surprisingly important and not as hard and not so hard to do, really. Like, on our site, you can see how many hours I sleep at night and how many cups of coffee I have. Like, having some personal human elements, I think, is extremely useful in being authentic.
Completely agree, especially as, like you said, Russell, there are robots who are providing information. How can we ensure we're still being transparent even about, results from automated systems? So along a similar line, we had one question from an attendee. So what challenges have you faced with regards to security and regulatory and compliance in this space? We know there's a lot of regulations, there's a lot of changing regulations with regards to privacy or interoperability. Can anyone speak to challenges in that space?
So I work obviously in our telehealth area at Beto, caveated by the fact that, we're really not diagnosing and treating because of solely the complexity that exists in this realm. The way the US is set up right now, in order for providers to practice that way online, you have to have licensure in every state where the patient resides. So, it's quite complicated, and layer on top of that, HIPAA compliant medical records, et cetera, et cetera. So depending on the level of setup you already have, whether or not you have a setup practice or not, that may or may not be easier to transfer. I say that because I don't think it's quite easy for anyone. There have been some eases in transition for certain practices. Given the pandemic, they have, made it lessened some barriers on this front. But it's, it's quite complicated, and also just easiest to go with a company that specializes. So there's like a lot of actual platforms and software out there that actually specializes in HIPAA compliant telehealth platforms. So that's really typically the easiest way to transition if you already have any kind of established practice in person that you would want to like take online, if that helps answer some of it.
Yeah, definitely. I think partnering with those who already are meeting regulations versus building it yourself, it's a good takeaway. Did Russell, do you have a follow-up?
Sure. Yeah. It certainly is a problem, and I probably say diagnosing at some point. We don't do any diagnosing, of course. I've most of what I've done is stay on the consumer health side of things and provide recommendations and education, which can go quite a far way. yeah, I've mostly intentionally avoided the more regulated space that makes things much slower and more difficult.
I guess I'll add, I'm not in health tech or digital health, so HIPAA compliance is not something I'm thinking about. But for one of my, for the capstone project I did during my master's program, one of the reasons why it kind of fell through was because of all the regulatory components of healthcare, the interoperability, HIPAA compliance. It was just so much, it's such a barrier to entry. And I think, like, sure, once you get over the barrier, you may, maybe all downhill, but just getting over that barrier was like we would have had to raise millions of dollars, and we just thought like it wasn't worth it. So a lot of regulatory components in healthcare.
A lot, which at times can definitely slow down innovation when thinking through actual effective tools for patients and helping diagnose or treat. So another question, really around closing the healthcare gap. So with innovation, obviously we're all thinking, digital tools and providing telehealth and other models to the patients. What work do we know as a panel that's being done to support kind of the older population who's not tech savvy, or perhaps folks in rural areas, to make sure that with all of this incoming innovation and technology, we're not widening the healthcare gap in the US?
I can speak a little to older populations. So we launched our sleep platform certainly with some intention, but not without limits as to who we would see and help. We planned to let that sort of play out and see who showed up a little bit. And surprisingly, a lot of older people showed up. Our imagery skewed younger, probably more like 20s, 30s than 40s, 50s, and a lot of 60s, 70, 80-year-olds showed up. We were not doing geriatric sleep. Geriatrics have a lot of sleep problems. So we were very surprised how successfully they navigated things and found us, even though we weren't looking for them or trying to find them. So there's certainly lots to do there, and I think older people can, especially with some well-designed technology, can navigate more than I expected, and probably more than we anticipate. But there's certainly lots to do, and they're more underserved than not. Like I mentioned, it was not our intention to find that space, but it's been a large population for us.
Yeah, I would say the same. I mean, for us at Beto, we work with perimenopausal, postmenopausal women. They find us. It's a huge group of people really that are out there needing better support, to be quite honest. So at least with the older populations, I think, if you're in the digital space and your space is friendly, it's not a problem. Like, these people are online, these people will find you, and word of mouth travels quickly. And from there, it's pretty fast. Even many women will say, oh, I've heard from my daughter, they helped me, if it's even like a slight barrier like that. When it comes to some of the more telehealth, like if I have a consult with somebody, some of the older women may prefer on the phone as opposed to like a video consult, which is fine. We just arranged for the phone. I mean, for me, it feels less personal because oftentimes you miss out on some of the personal aspect of being able to see somebody's face and see how they're communicating. But we're always happy to do it however women feel comfortable. And then, with the healthcare gap, there's a few other parts we talk about, and I think I saw it in the questions about, rural populations, people with maybe limited access to the internet. I think generalization, there's obviously people that don't have access. Most people, I think, at least have some way to access internet in some form, maybe not 24/7, but whether that's through a local library, through a school, through whatever means that they're connected with in their communities. And at least at Beto, we find oftentimes that our largest subscriber bases are coming from people in the South and from rural America, where their access to actual providers is very limited. So those are the people that are actually reaching out to us the most, because they don't have the easy access in the office to a provider. They don't have that easy way to communicate with healthcare providers because the actual healthcare infrastructure isn't there. So we find that we are filling that gap, at least right now, with what we're doing, which is really reassuring.
Yeah, it's a great point. So in the sleep space, I think between Boston, Philly, and probably San Francisco, it's about a third of all clinicians are in those three places, and that lots of places have effectively none. People are hundreds of miles away from a sleep clinician, and it's more extreme in sleep, but common across lots of categories. We've had in both baby sleep and adult sleep, we've had a very geographically diverse population that's come for help. Because our help it's in their pocket and not hundreds of miles away.
Yeah, I really like that idea of technology kind of filling the gap when the clinician is not available or nearby. It's probably a good transition to some of the questions in the chat. And those who are in the audience, feel free to add questions to the chat. We know during COVID, doctors' offices were closed and it was very hard to get in touch with providers. So what interesting projects have you all worked on during COVID?
I think I could start. My interesting project was Healthcare Huddle. And I think that would, if the pandemic, awful, but it did, my classes switched to online. Medical school, I was taking all my classes online, and it was distracting, but I could work on Healthcare Huddle in the middle of class and stuff like that. So I had the opportunity to do more work on the Huddle. My brother Brett works at Capital One. He would have been in Richmond, Virginia, but he's still home working in the basement. But he has more time to work on the Huddle, and I think it was this unique circumstance. You either master your circumstances or become mastered by them. And I think we really took advantage of the pandemic, the time we have to really launch ourselves to where we are now.
Yeah, it was certainly a good period to be kind of heads down doing work. I wrote a lot of blog posts, did a lot of writing, did a lot of analysis. In previous years, I've traveled a lot, so I didn't do any of that, and it really provides a lot more time to do things. So, it hasn't been a great time to make new connections, though we certainly made some, and some of our partners were moving certainly slower than average. But we certainly got a lot of productive work done and ready for new things.
I think for us, the pandemic really brought on a lot of question about what is the research going to show in relation to women's health and this virus. It interrupted a lot of fertility cycles for many of our customers, a lot of questions, for our pregnant customers. What should I be worried about? What can I be doing? What shouldn't I be doing? So really being a resource for these women, a source of, comfort and reliable information that was, as based in medical science that we could have at the time, understanding and knowing that it was limited at first. And, as time has passed, we've gotten a little bit more, but still we have a long way to go when it comes to really understanding what, the COVID and the vaccine mean for all of these conditions. So that's been a constant area of focus for us with our customers right now.
It's very interesting. And maybe Andy, along that point, so does your company really wait for guidance from, the WHO and other organizations before being able to provide support to your user base? Or did you feel the need to really fill that gap until there was sufficient data out there?
Yeah, so I think, similarly, we're not diagnosing and treating. So we're primarily offering recommendations based on the information that's out there. So we definitely look to organizations like the WHO, organizations like the CDC and ACOG, ASRM, which would be kind of the leading governing bodies in the work that we're doing to, look for specific medical data that have to do with, reproductive status and kind of anything really. So whether that is, like in our supplements, exactly how much folic acid we're including to ensure that women are getting the recommendations to prevent neural tube defects to, these new things that we're considering now with viruses. So yeah, we're, always trying to stay up to date with that, which would probably be a great reason to be checking out Healthcare Huddle and, just keeping on tabs with the new information that's coming out, which can be overwhelming and a lot for any provider, right? So, a lot of these women are asking their providers, but, as a provider, your focus oftentimes is on providing care, not necessarily like scouring the news and checking the latest research articles that come out. So we're able to do some of that bandwidth for these women.
Great, thanks. I'm going to take one of the questions from the chat. So this is from Sean Farrell. Healthcare is the one industry in which costs are rising in lockstep with technological advances, example, computing and AI, which is counter to how the cost profile of other industries evolve. How do you think digital solutions can work to both improve patient experience and health outcomes while reducing out-of-pocket costs in the long term?
I think I started that one. It's a good question. I don't know that there's been, to date, I think technology has probably equally as much been in the way as it has helped. That's true not just in healthcare, but other places as well. It's probably lagging further in healthcare. And that hopefully that changes. And healthcare is still running largely like it's run for decades. And I think sort of transforming the model is a thing that hasn't happened yet, and a thing that probably can happen in the future. For example, we still expect to see our doctor and talk to them, and for them to do customer service. It's one of the few industries where customer service is performed by the most expensive person on the team. And I kind of think it's going to change at some point. You can talk to people in different ways and in different modes. Like when I get my car serviced, I don't actually talk to the mechanic, and lots of other places I don't have a direct interaction with the expert. I get customer service through another mode. And I think there's lots of ways like that where a reimagined technical solution, changing things. Maybe these are bad examples, but some more transformation of the way care is delivered will probably occur. Will hopefully occur. And there aren't the same cost pressures, but these things could change with some more decisions.
Yeah, and I think too, incentivize, like so much of at least the way the U.S. healthcare system is set up right now is reimbursement. A lot of what drives how our systems work is based on reimbursement. I even think about, as a PA, I can offer the exact same care as a physician counterpart, and my reimbursement is going to be lower than the physician counterpart. That doesn't make sense. We're providing the same care, assuming that it's in my scope of practice. So there's, certain things that are set up in our systems that aren't incentivizing the right things. I think a major thing that could be helpful is really trying to, obviously we need sick care and help for patients when they're sick. Of course, we have all sorts of different diseases that need to be treated, but also really focusing on well care and incentivizing well care and reimbursing for well care to keep people healthy and keep the focus on staying well, instead of then getting to a point where you need the sick care, could be really helpful. It takes a lot of work to get there.
Yeah, I'll just add, healthcare is very confusing, and why do costs continue to increase if the value of care delivered isn't increasing? It's so backwards. My one professor, going back to the healthcare systems engineering program, Professor McDonald, always used to say, follow the money. If you want to know why something's happening, just figure out where the money is going and you'll find the root cause. And I think it's going to take some sort of reform. So someone mentioned like taking a systems level approach to fixing healthcare. And I think that's what's needed.
Yeah, I really like, Andy, your point about preventative care and really prioritizing that over just waiting for people to get sick. So I know a lot of large employers have tried initiatives to, motivate patients, whether it's a step challenge or whatnot. Do you see any good opportunities for patients to really be motivated to care more about their, preventative health and less about getting sick? How do they fit that into their everyday life?
Yeah, I think it's interesting because we're seeing the pandemic this past year has been so challenging for so many reasons, but I think kind of one of the glimmers of hope for at least what I've been seeing is that it's given people time to kind of sit back and say, wow, my health is very paramount and very important to me. What can I be doing right now on a day-to-day basis that's going to make a difference? I know in PA school, I'm sure in medical school, nursing school, it gets drilled home every day. Lifestyle and diet, these choices, these simple things that we do every single day are so compounded and make such a difference. Sleep, I mean, talk about all the things that we're talking about right now, right? Like I always say to every single person I talk to, sleep is the most underrated thing that you can do to care for your body. It is so important and restorative, and people do not value it enough. We live in this society that says, oh, just stay up the extra couple hours to get that grade or finish that project and it's okay. Well, that's just undermining your health is what it's doing. So, really changing the framework of how we look at things and, starting with how we're teaching our youth is going to be really key, right? So hopefully getting this great information, engaging people that are, it's never too late to change your habits ever, ever, ever. So, even if you have some bad habits, changing them now is only going to help your body. And then, showing people and modeling the people in your life about how important that is, and creating that culture of change it really just goes such a long way.
Great. If there's no follow-ups to that question, I think we've reached the end of the questions in the chat and those that were provided beforehand by the alliances. So I can hand it over to Anna for the closing.
Thank you. And thank you to everyone, to our audience for being here this evening. I am a brand new member of the Healthcare Alliance. Excuse me. I graduated in late 2019 with a bachelor's in bioengineering, and I'm currently a healthcare systems engineering master's student. If I hiccup, I swallowed some dirt outside earlier today, and it's still there. But yeah, and when I graduated from my undergrad, so I did ROTC at Lehigh, and so now I'm in the Medical Service Corps, part-time in the reserves, but I'm currently doing some training here in Fort Sam Houston and San Antonio, Texas. So a different weather scene for me, but it's been really exciting and I'm learning a lot about being the medical officer. So again, thank you everyone for being here tonight. To our panelists, I'd love to enforce that we can continue this conversation on Slack. Right after I'm done speaking, I will put in the links that Mo was being really vigilant about earlier. I just want to make sure everyone has access to the Slack network, because that is really wonderful with providing everyone the opportunity to continue asking these questions. I've been documenting them because there are some incredible ones, and if we run out of time tonight, which I want to make sure everyone gets out, but just want to make sure we get those questions answered and continue this conversation. And again, thank you to our panelists, Jared, Andy, and Russell. Of course, our moderator, Kelsey, for being here tonight, your time and participation in this discussion. I hope everyone learned something and had some takeaways this evening. The Healthcare and Innovators Alliances as well, especially Mo and Morgan with Alumni Relations. Thank you for putting this together. I am happy to be here tonight as we close. Tonight's event embodies the mission of the Healthcare and Innovators Alliances, as well as the Alumni Club of Boston, as well as all of the affinity engagement groups of Lehigh. I assume we just intend to promote the active and meaningful engagement for alumni and students, whether you're currently in the field of healthcare and innovation or interested in these industries. This was intended to gain insight and expand ideas and develop new perspectives in tonight's case and current initiatives in healthcare innovation. So we definitely want to continue to create events to connect with our accomplished alumni network, such as yourselves. And so I invite you to continue to connect with the alliances and keep an eye open for future events via Slack and email. That'll bring you to things like tonight, and hopefully we can continue to address these pertinent issues. And also, if you have any ideas of themes or things you want to see next time, please provide that feedback to us, because the Healthcare Alliance, at least, is definitely looking for more events like this. They'll probably be virtual for the time being, but we'll see if we can get in person sometime soon. So I hope everyone stays safe. And again, I'll put those links in the chat for you all. But without further comments, thank you all for being here. Thank you.
Awesome. Thank you, everyone. Have a great night.